Now, moving on to the COVID-19 situation here in Korea, though we've seen a drop in the number of daily COVID-19 infections, deaths related to the virus have climbed up.
Just on Thursday, Korea logged the highest number of daily deaths, but authorities are stressing that we have a low fatality rate. For more, we turn to Shin Ye-eun, who joins us live in the studio. Good morning, Yoon.
Good morning.
So how many cases are we expecting for today?
Well, Mok-yeon, we're expecting to see the daily caseload hover in the 300,000s because as of 9 p.m. on Thursday, we have recorded 328,909 COVID-19 infections. Now, this was down by more than 51,000 from the same time the previous day, and compared to a week ago, figures have crawled down by 64,000. And for 2 straight days, we've been seeing caseloads drop, but authorities aren't being too hasty as to whether we've actually passed through the peak of the Omicron surge and have entered a phase where infections will drop.
You know, it's one of those good news, bad news thing. The good news is we are seeing the infection numbers dip down, but the bad news is we are seeing a very high number of fatality. Now, you know, even Thursday, we saw record high numbers. Now, the interesting thing is, some of the authorities are saying that we are seeing a low fatality rate, but at the same time, some of the experts kind of beg to differ. Can you tell us about this?
Sure. Just yesterday, as you mentioned, we saw the highest number of deaths from COVID at 470, bringing the total death toll of COVID to 13,902. And this is only from infections added 2 or 3 weeks ago when daily tallies hovered in the 200,000s. Recently, we've been seeing numbers stay in the 300,000s or 400,000s. And last week, we had the highest addition of over 620,000. And this means that Korea may see double the amount of deaths as now, bringing tallies to more than 1,000 deaths a day in the coming weeks. And a few experts say that we may actually have 2 or 3 times more deaths than the total tally announced by the government, given that there are some deaths the government doesn't know of. And this includes those who died of complications after completely recovering from COVID-19, or those who were infected but didn't know about it, or those who couldn't get proper treatment because they weren't at any hospital beds. There weren't any hospital beds available for them. But the government is saying that South Korea has a low fatality rate at 0.13%. Authorities added that the official death count includes those who have underlying conditions and didn't die from symptoms of COVID, but their previous health conditions. And both health authorities and experts say those at high risk definitely needs to be treated effectively.
So, Yoon, how can high-risk groups be treated effectively? Any propositions?
Well, experts have called for more management and caution at nursing homes, which take up 1/3 of all deaths. To that, authorities said they will prescribe more antiviral pills and put more effort into treating COVID-19 patients with underlying conditions. Authorities believe that this particular group is at high risk, and many need more monitoring and management to treat their initial illness rather than just COVID. And that's why officials have been discussing whether to stop giving out rapid antigen tests at all screening clinics. This means that only people at high risk will be tested by medical staff, and they will be tested using PCR tests. Everybody else will have to use self-test kits, and authorities are considering to provide them at the screening clinics. So far, most districts have agreed to this decision in hopes that medical staff out at screening clinics can instead focus on treating patients. If discussions go as planned, this change could come in from April 4th. This is also when the country expects to kick off new social distancing measures.
All right, so let's move on to the vaccination front, because starting yesterday on Thursday, we did see the reservations for Pfizer shots for children aged 5 to 11. But the big question is, are parents on board with this?
Well, the majority of parents don't want their children vaccinated, at least not at this time. The Central Disease Control Headquarters conducted a survey on some 359,000 elementary school parents to ask whether they were willing to vaccinate their child. 6 out of 10 said no. Most parents said they wanted to check the waters and wait for more related studies and cases of child vaccinations, as most are concerned about side effects. And experts said this type of information should be transparently delivered. Now, this comes as vaccinations for this age group are set to kick off on March 31st.
All right, Yoon, thank you so much for your report. We appreciate it, and have a great weekend.
Thank you so much.